Hi, I'm Robbie Wills, lobbyist for the Arkansas Chiropractic Physicians Association. Thank you for joining us today for this presentation on the Arkansas Legislature and the future of the Arkansas chiropractic profession. We're going to walk you through three things today. First of all, the accomplishments that the Arkansas Chiropractic Physicians Association has had in the 4 years that I've been your lobbyist. Secondly, the agenda that we have moving forward for 2015 and beyond that will be of benefit to the entire profession and to you as an individual doctor. And third, how you can help make all of this happen by working with the Arkansas Chiropractic Physicians Association. So first of all, we want to give you a brief overview of the Arkansas Legislature. The General Assembly consists of two houses, the House and the Senate. There are currently 51 Republicans, 48 Democrats, and 1 Green Party member in the Arkansas House of Representatives for a total of 100 members. And in the 35-member Senate, currently there are 21 Republicans and 14 Democrats. All of this is subject to change, of course, on the November 4th general election. The next Speaker of the House will be Representative Jeremy Gillum. He will take office in January of 2015. He's a Republican from Judsonia, Arkansas. And the next Senate President Pro Tem-elect will be Senator Jonathan Dismang, who is a Republican from Beebe. We want to walk you through some of the accomplishments that the Arkansas Chiropractic Physicians Association can point to in the last 4 years as the results of our hard work. Starting in the 2011 session, the Arkansas Chiropractic Association, the Arkansas Chiropractic Council began working together under the umbrella of the Arkansas Chiropractic Coalition. This past year, they made that partnership formal by merging into the Arkansas Chiropractic Physicians Association. And we've been working on several things the last several legislative sessions. In 2011, we really set out to rebuild the brand of the chiropractic profession. So we decided it was important for us to speak with one voice, have one lobbyist, and move forward from there. The issue that we worked on in 2011 was Medicaid direct access. And this is simply the concept that someone on Medicaid should be able to self-select their own doctor without going through a gatekeeper. As you know, the Medicaid program requires a Medicaid recipient to go see a primary care physician and get a referral before they can come see a chiropractic physician. We presented a bill to the General Assembly in 2011 that advanced this concept. And although we weren't successful in passing the bill because of a number of factors, we did get the issue out there in front of legislators and got them thinking about the best way to get patients to quality care while also saving the state Medicaid system money. In 2013, we were going to bring that Medicaid direct access bill back to the General Assembly, and then something else happened. Governor Beebe and the Republican leadership of the House and Senate decided to move in a different direction with something called the private option. This is basically an implementation of the Affordable Care Act, whereby states are provided funding by the federal government to go out in the private sector and purchase health insurance for eligible Arkansans. So under the private option, Medicaid eligible Arkansans, these are people who have up to 138% of the federal poverty wage, are able to purchase private insurance through an exchange. The federal government pays 100% of the premiums for the first 3 years, and the feds pay 90% of the premiums afterwards. Up to 250,000 more Arkansans are covered, and over 200,000 Arkansans are already enrolled. Under the private option, the same rules apply as under the Harkin Amendment to the Affordable Care Act, and chiropractic has to be covered. Up to 30 visits a year with no referral needed from a primary care physician. And the state can no longer advertise the program, so healthcare providers like you will have to pick up the slack. In anticipation of the elections this year, the Arkansas Chiropractic Physicians Association sent out a questionnaire. The questions were very basic and gave legislators a good idea of our position and what we were trying to accomplish from a policy standpoint. The first question was, do you agree that chiropractic physicians have the education and training to effectively treat their patients? The second question, do you agree that when chiropractic physicians are utilized, significant cost savings are realized? The third question was, will you support measures allowing Medicaid patients direct access to a chiropractic physician? And the fourth was, will you support coverage of chiropractic treatment for injured employees and workers' compensation plans? Happy to report that While in 2013, only about 20% of the candidates that we sent a questionnaire to actually responded and sent it back in, this time it was close to 70%. So we had an overwhelming response, and 99% of those questionnaires that were turned back in had favorable responses. We use those questionnaires to make decisions on which candidates to support in the general election. And we were able to support a number of candidates in the 2014 election cycle. The Arkansas Chiropractic Physicians Association has continued to work on our agenda for the 2015 session and beyond. We want to talk about some of those issues now. Our 2015 legislative agenda starts with renewing the private option. This program came under a lot of criticism from many legislators for being too costly and the funding not being guaranteed for the long haul by the federal government. It's anticipated that the next governor will have some version of the private option before the legislature for consideration. Whatever the replacement is, we believe that it will have to continue to comply with the Harkin Amendment to the Affordable Care Act and provide coverage for chiropractic. Secondly, we want to revisit the Medicaid direct access issue. After all, if 200,000 Arkansans who are on the private option have direct access to a chiropractic physician with all the health benefits and cost savings associated, why shouldn't we offer the same opportunity to Medicaid recipients? And finally, we want to raise other issues like the workers' compensation issue and other issues in front of the legislature that will have an impact on chiropractic patients and chiropractic physicians. And finally, we're going to continue to build the Arkansas Chiropractic Physicians Association brand. ACPA is the only membership-driven organization in Arkansas dedicated to forming public policy and lobbying the legislature for the betterment of chiropractic patients and chiropractic physicians. Working together, we can get a lot done, but we need your help, and that's what we want to talk about next. How can you help ACPA accomplish the goals that we have for the profession and for chiropractic physicians around the state? First of all, please join the Arkansas Chiropractic Physicians Association. There are several levels of membership, and there are options available for a practice of any size. Secondly, support the ACPA PAC. It's very important that we show our support for candidates for public office, both those who are already in office and have helped us in the past, and those first-time candidates that we hope will help us in the future. Supporting the ACPA PAC with even a $100 contribution makes a tremendous difference in our efforts to lobby the legislature. Thirdly, support the candidate of your choice. So whether you make a $50, $100, or $500 contribution to a local legislative candidate, while you're there, mention the ACPA and your membership and your support of the organization so that we can also approach that legislator and offer our support. And finally, help us lobby the legislature. There are no better lobbyists in a legislative district than a local chiropractic physician talking to their local legislators about issues that affect the profession. There are many online resources for you to take advantage of as you contact candidates and legislators. The Arkansas Legislature has a website at www.arcleg.state.ar.us that'll give you information about legislators, committees, and bills that are being considered by the General Assembly. The Arkansas House of Representatives also has a website at arkansashouse.org where you can find information about bills and resolutions and even watch a live video stream of the Public Health Committee and the full House of Representatives as they debate bills and resolutions and issues. The Arkansas Senate has a website as well at arkansas.gov/Senate. And finally, our website at robbiewills.com for the Wills Law Firm can give you information about issues of general interest. We also send out a legislative update every week to the ACPA listserv that you will be able to hopefully receive and follow. But if you ever have any questions, please don't hesitate to contact me at 501-730-4677 or rwills@cyberback.com. I want to conclude by saying my wife Dana and I are honored to be the lobbyists for the Arkansas Chiropractic Physicians Association. We're not just your lobbyists, we're also your patients. We're both longtime chiropractic patients. Both of us were in very serious car accidents and sought treatment from a chiropractic physician afterwards. In my particular case, I'd been through a number of healthcare providers and tests and probes and medications It was only when I saw a chiropractic physician that I got back on the road to recovery. I've never forgotten that. I've also never forgotten that the Arkansas Chiropractic Coalition was the very first client of the Wills Law Firm when we started lobbying. We take this very seriously. We believe in you. We believe in the profession. We want to ask for you to believe in the ACPA. Do everything you can to help. Please join. Please contribute to the PAC. Please contribute to the candidate of your choice. And please stay involved. For the Arkansas Chiropractic Physicians Association, this is Robbie Wills. Thank you.